Hello, welcome to another life-changing edition of New Beginnings. This is your host, Ferlie Almonte. We will all get there some way, somehow. We turn 65 and suddenly we are bombarded with a lot of mailers, TV ads, very confusing information all over, making us decide on what Medicare options to choose. Well, today we're going to demystify Medicare for you, because right in the studio today we have the owner of Golden Years Design Benefits, Rubin, and also Medicare specialist, Leon Spencer, who's going to actually enlighten our minds with what it is to do when we make the decision to take Medicare. Well, let's start now. Oh my God, good looking gentlemen.
Well, thank you very much.
Thank you.
I appreciate that.
Well, Medicare. Tell me, what exactly is Medicare?
So, Ferlie, thanks for having us today. So, Medicare is a federally run health insurance program for people that are 65 or older, or for certain people with disabilities.
Okay. And so you said you have to be 65 to do that, right? And so what basic information do we need to know or be prepared for when now it's time for us to decide to elect Medicare?
Yeah, so everybody is in a little bit of a different situation, and that's really why you want to talk to an expert or a consultant that understands the different options, because people are very nervous about making a mistake, right, and going down the wrong path. So when people are turning 65, we want to understand what their work situation is. Are they working? Does their spouse work? Because some people are not required to enroll in Medicare at age 65. So when we sit down with somebody for a conversation, we're going to find out how old they are, what their birthday is, and what their current health insurance situation is, and then we can sit down and walk them through what would be best for them.
Who really qualifies for Medicare? I just want to be clear, because you were saying that certain people do not have to take Medicare.
Yeah. So again, the qualification is, are you 65 or do you qualify for some type of disability? All right, so people that are on Social Security disability for 2 years become eligible for Medicare, and then they have the choice of taking Medicare or Ferlie keeping their current coverage. So it really comes down to their work coverage and whether or not they should elect Medicare or not.
And what does Medicare cover? If I get sick, okay, what, I'm just saying, like, there's a lot of people out
How
there
does
like,
Medicare work? And,
exactly.
And if it does, what are the out-of-pocket costs for clients or for our clients,
like,
right?
Is it free?
So Medicare has a monthly premium,
Okay.
and this year it costs about $164.90. $164.90. Depending on your income, you could pay more, but the average American will pay $164.90 a month. And if our clients are collecting Social Security, then that will be debited from their Social Security benefits.
So you're saying that when you collect Medicare, it will be taken off your Social Security benefits automatically?
If you're collecting, but not all of our clients are, they're going to continue to work, and some may defer that Social Security benefit enrollment.
Do you have the option to pay out of pocket?
So if you're collecting Social Security, there's no option. The government takes your money out of your benefit, all right? No option there. However, if you're not collecting that benefit, then you could pay through a credit card, through a checking account, or you could send in a check.
Quarterly, yeah.
Leon.
Yes.
Okay, here I am. Well, I'm not 65 yet, but one day I'm going to
You're
be.
way too young for Medicare, Ferlie. We know this.
Okay, so now when I am ready to be, to talk with somebody like you, okay, I am also getting a lot of phone calls, right?
Sure.
And so, there's a lot of solicitors out there. Well, we do not know who is seasoned or not. You obviously are very experienced in Medicare.
Right.
Right? So, first of all, why should I not be talking about doing it myself? Okay, because there's a lot of people there, I can do it easier, cheaper,
right.
whatever it is, doing it by myself. Why should we not make that mistake?
You want to talk to an expert that can show you the different options you have. Because you got your Part A by working, right? 10 years, 40 quarters, you got your A, right? And then you get Part B, as Devin said, costs you $164.90 a month. Right? We have to determine if your job insurance is going to stay in place or if Medicare is going to work for you. It determines if you're going to keep working, if your spouse has coverage for you. You don't want to just pick up the phone and call somebody from a television commercial. You don't know who you're speaking to. You don't know where they're located. We're consultants right here in New Jersey, in Freehold, New Jersey, so we can help you and consult with you, soup to nuts, and then you make the final decision.
So do you pay a fee to you guys by?
So there's never a fee to work with a licensed insurance broker, right? And so some basic tips for choosing a broker. Number one, how long have they been in business?
Right.
How large is their staff? Do they work out of their house? And do they work with all the insurance companies in New Jersey? So as a independent broker, we get appointed with 9 different insurance companies, right? And then we demystify and walk through your plan choices. We look at your doctors, we look at your client's medication lists, and then we come together and say, hey, these are maybe 2 or 3 good options for you. We'll narrow it down from 25 to 30 different options.
Oh my God. Now I understand why people are getting so freaking confused.
Right.
You're saying that there are 25 different options, because I just heard Leon say A, B. Okay, all right, what makes it A and B?
Yeah.
Do you have some kind of like a very simple, basic framework to start with, like that would help people understand Medicare better?
So there's no, we've had this conversation before, there's no simple solution to it. Medicare is complex, right? And that's why people work with brokers like ourselves. But typically what we do when we're helping a client and we feel like our job is helping people.
Absolutely.
Right? Because if we can't help a person, we're not going to put them in the, in the wrong plan.
Right.
But basically, our goal is to educate our clients and our prospects. And we think if they understand how Medicare works, then we'll take them down the framework of either choosing a Medicare supplement plan and a drug plan, or to take the bundled all-in-one Medicare Advantage plan. And so really it's about a 5 or a 10-minute conversation with somebody to talk about the benefits, the pros and the cons of both options that seniors have.
Do they have to go and see you, or can this be done over the phone?
So Leon, how do you like to do it?
So we can do both. I like to do the phone. Sometimes in person is good, but we can explain everything by phone, how it works, what the options are, the difference.
And I would say, 3 years ago, we did most of our appointments in the office, but I think with COVID, our office is doing a lot on Zoom, right? We're doing a lot over the phone, and we could be as effective with educating you whether you come in person or we do over the computer, and depending on how tech savvy a person is. But I would say most of the appointments that we do are probably either over the phone or Zoom at this point.
Yeah.
No. Most of the people who are 65 and up are a little bit tech challenged.
Yes.
And so they feel very intimidated that they have to fill out the application online or even sign a document online, because they are they're scared about cybersecurity, whatever it may be.
Right.
So how do you address that?
So that hasn't really been our experience. I think because we've spent an hour to an hour and a half with them, educating them, picking out the right plans. The technology has really come. The technology has come leaps and bounds over the last 2 years. Where basically, after we agree to the plan, we're sending them an enrollment link, and as long as a person has access to email or text, all they're doing is just hitting a couple buttons, typing in your name, and hitting a button. I would say 98% of our clients are able to do and sign the application paperwork right over the phone or right through their email. It really has become a non-issue.
So what most common questions do you face, like constantly, that people who are very confused come to you with?
So number one, what's the difference between a supplement plan and then you got the Joe Namath commercial? Medicare Advantage, what is it? How do I get it? How much does it cost? When will it start? Those kind of questions. So we explain all that in simple terms, so that a person will be able to walk away from us and go, wow, I got it now, and then make a decision.
No, you had said something about when does it start. Is there an enrollment period that they must adhere to?
Yeah. So when our clients are turning 65, there's a 3-month window before their 65th birthday, the month of, and 3 months after. That's what we call the Medicare initial enrollment period. That's when you can enroll into Medicare A and B without regards to any penalty. If you miss that window and you really should have enrolled in Medicare, then you would be subject to that penalty.
How much is that penalty about?
So it's 10% of $164. But the worst part is that it stays with you, right? It never disappears. So
What do you mean? Like, so every month after month, I would have to
if
keep
you make a
paying?
mistake and you don't enroll when you should have, then you're going to see your penalty get tacked on to how much your Medicare premium is, and that stays with you forever.
Oh, wow.
Yeah, it's like
so it is very important. And now I understand why you keep getting bombarded with like a lot of mail, right? Like a lot of mailers and calls to make sure that before your birthday,
Right.
that you don't miss out on it. Oh, it's something that they don't even talk about. So thank you for sharing that. Now, you were saying that people pay a certain amount of money for Medicare. Up to what kind of percentage does Medicare pay for, like, your hospital bills or doctor's visits? And how much will be coming out of my pocket?
Yeah, so I think to do that, one has to understand briefly how Medicare Part A works and how Medicare Part B works.
Yes, please take time to explain
Right,
that.
so that's what we call original Medicare. So Part A would be an overnight hospital stay. So if somebody goes into Brick Memorial Hospital and is there for 3 days or longer, that stay is going to be filed under Medicare Part A. Medicare Part A has a deductible of $1,600. So if somebody goes in the hospital and has a $10,000 medical bill, then their responsibility without a plan would be $1,600, and then Medicare would pick up the rest. Right? Medicare Part B is considered doctor visits and outpatient services. You're going to pay a monthly premium for that, the $164.90, right? And then there's a deductible of how much?
So it depends. Depending on the plan, if you get a supplement plan, it's taken care of. If you're in an Advantage plan, you may have some co-pays when you go into a hospital, and we'll get into that in a few minutes, how it breaks down as far as cost.
So original Medicare, you pay a premium to the government that comes out of your Social Security, and then original Medicare has a deductible of $226.
Right.
After that $226 is paid, Medicare kicks in, pays 80% of all eligible expenses, and then you would pay 20% without either a Medicare supplement plan or a Medicare Advantage plan. Now you can imagine if somebody had a $100,000 medical bill, how much they have to pay on the 20%. Right. So after we explain to our clients how Medicare A and B works, then we can get into the products that we sell. But we can't ever get there until somebody has a basic understanding of how Medicare Part A and Part B works.
So you're saying because there is also like out-of-pocket expense like the deductible, so people on a limited income, what do they do? Do they buy another plan to be able to cover that?
Well, I think most people are worried about the 20%.
Right.
Yes.
Yeah.
Right, that we talk to. So nobody wants to be on the hook for 20%. You know, a limitation of keeping original Medicare is that there's no maximum out of pocket.
Right.
So what is the maximum out of pocket?
Right. So it can go on forever. There's no maximum out of pocket.
It's like the Energizer Bunny, just keeps going, right?
Yeah, absolutely.
So what we do, because there's no maximum out of pocket, that's why insurance brokers either sell a Medigap or a Medicare supplement plan or a Medicare Advantage plan, which bundles all of your Medicare into one card.
I have an aunt who was 96.
Wow.
I know she had Medicare, but she was also paying something like $260 in addition, so that she says, I don't have to worry about anything else. Is that the gap that you're talking about?
Right, so think about Medigap, right? Think of it as an all-inclusive resort. I like to tell stories and analogies for our clients. All-inclusive resort, right? You pay a fee up front, and then when you go to the resort, everything's taken care of for you. Your food, your beverages, right? Your entertainment at the resort is paid for. That's very similar to a Medigap or a Medicare supplement plan. Because what they do, what the Medigap plan does, it covers all of your eligible expenses under Medicare Part A, all right? And then some of the plans will cover the 20% in full. right? Just leaving you a small $226, and then you're covered for eligible expenses
But
under
then again,
Medicare A and B.
It concerns me for, say, for example, people who are on a very limited income. If they're paying $164 and then an additional $200-something. So now you're talking about a big chunk of money if you're receiving only Social Security income. So does that now put them in poverty or Medicaid?
So I had that same issue come up last week.
Okay.
Husband and wife, both retiring, $164 each, that's $300. Medigap plan, another $150 each. So now we're talking $600.
Yes.
And they were, well, we don't know if we could afford that. So you give them the other option, which is an Advantage plan.
What is an Advantage?
So an Advantage plan, number one, has to cover everything that original Medicare covers, right? And we all know that Medicare doesn't cover what? Dental, vision, and hearing, right? So when you enroll in an Advantage plan, you get everything thrown in together. Your prescription, your dental, your vision, some of them offer over-the-counter benefits. So it's all included in, and there's no monthly premium in most cases.
Most plans are zero premium.
Yeah.
There are a couple plans that could be $20 or $30.
Right.
But in general, we're recommending zero premium PPO options to most of our clients here in New
So who qualifies
Jersey.
for that Medicare Advantage plan?
So anybody would qualify for a Medicare Advantage plan. It's not an income-based program.
Right.
Some people would rather pay up front, which is what a Medigap plan is, right? But anybody that's enrolled in Medicare A and B and lives in the service area in which the insurance company sells the plan is eligible, period, end of story.
Right.
So as a senior, you have a choice of either choosing Medicare Advantage, which is generally zero premium, or prepaying with a Medicare supplement plan. So it's really up to the client and what they're looking for in terms of their health insurance options.
Now, you said that you also work with many other different insurance providers, right?
Right.
Does that affect the price?
No, not at all. Still, depending on the plan, if it's a Medicare Advantage plan, zero premium. Some of them have $20 co-pays, but it doesn't matter. If the plan works for you, your doctors are in the plan, it's not based on your income.
And so if you work with a broker, right? There's lots of brokers in the area. They're not all as good as Leon is. But if you work with a broker, right? This is a question that we get asked all the time when we're out in the community and doing seminars helping people. There's no fee to work with Leon. Right? You would never pay more to work with an insurance broker. So you could call the insurance company direct. You can call 5, 6, 7 companies if you want, or you could work with somebody that you trust that's been doing it for a while, and there's going to be no difference in your out-of-pocket cost because we don't charge any fees, and it's going to be the same cost if you go direct or working with a licensed insurance broker.
Do your clients have to go to a list of participating doctors only?
So I'll give this one to Leon.
So, in an Advantage plan, we want to make sure that your doctors are in the plan. There are two types of plans. One is called a PPO plan, which means you can go to doctors that are both in and out of the network. There's a small fee if you go outside of the network, so we try to recommend that you go to doctors that are in the network. Then you have what's called the HMO. All of your doctors must be in that HMO, because if you go to a doctor outside, you'll have to pay the full cost. So we want to make sure we try to steer people into a PPO plan because it gives them more freedom and more options.
How much more typically when you say like for a small fee? Because small fee is very relative.
So for example, you may see your primary care doctor, $0. You may see your specialist, $20. Out of network, it could go to $40.
So each plan is different, so it's really hard for us to tell you about the differences. Sometimes there's co-insurance involved, right? So each of the different insurance companies that we work with have differences if you decide to go out of network. Leon and I generally recommend that you stay within your network of doctors and providers, otherwise your costs are going to be higher, and that's just going to be dependent on the plan that we figure out together.
And here's something, what if this 65 and up community, actually some of them are snowbirds, some of them
Yeah.
travel a lot.
Happens all the time.
Yes, and what happens if they are out of the country and something happens to them?
So the good thing is, in both the supplement plans and most of the advantage plans, you do have worldwide coverage. Most of them up to $50,000 of worldwide coverage.
That's for the supplement.
Right, and some of the advantage plans offer it too.
Yep.
So you're covered, and in the event of an emergency, God forbid, where you have to go into a hospital, you're covered automatically.
Okay.
So Medicare Advantage plans have something called emergency coverage.
Right.
So if you're visiting a friend down in Florida, or if Leon's vacationing in Arizona, right? Some of the plans that we work with actually can extend their network.
Yeah.
If we're looking at a Medicare Advantage plan in other areas, Medicare supplement plans, which work a little bit differently, work with a nationwide network of doctors and providers, and it's really less of an issue when you're traveling.
You had mentioned before that some Medicare premiums are income-based. Help me understand that, so if I am an attorney, a doctor, and high bracket, high income bracket, how does it affect the premium?
Yeah, so everybody pays something different for Medicare. Now, forget about the insurance that we
Right,
sell, right? We're just
exactly.
talking about having original Medicare Part A and Part B, right? That's the program through the federal government. And so this is going to be based on your federal tax return, right? The government's going to look at your adjusted gross income, I should say, your modified adjusted gross income, and there's 5 different levels, right? So if you made more than $750,000, right, you could be paying north of $600 to have Medicare Part B, and also for the drug plan as well.
It probably still is a lot less than how much it would be if you have to buy private health insurance, right?
So many times it is, right? That's one of the things that we specialize
Right,
with,
exactly.
is when a client is trying to figure out, should I keep my coverage at work, meaning should I keep my employer benefits, or should I enroll in Medicare and pick a secondary plan, right? That's what we do for a living. That's our expertise. What we'll do is we'll ask the client to give us we'll ask the client to bring in their summary of benefits and how much the costs are. And we'll create an Excel spreadsheet, right? Who doesn't love a good Excel spreadsheet?
Exactly. Absolutely.
Right? We'll do an Excel spreadsheet. On the left would be your employer coverage, and on the right, we would break out your Medicare costs. And then you'll leave with exactly what the numbers are and what the benefits are. People find this to be it gives them a lot of relief once they're able to have somebody that they trust go through these options with them.
That's awesome. Like a side-by-side comparison always helps.
That's the only way to do it.
There's a lot of people who are very visual because you can't tell me numbers and then you would forget. But seeing it side by side, that really helps. Leon, all right, say, what do I get very special about working with Golden Years Design Benefits, when I come to your office and I work with somebody like you?
Well, number one, you get seasoned veterans that have been in the business a long time. Most people.
How long? How long? Not that I'm going to date.
Well, our company's been around for 35 years. I've got close to 15 years experience, both supplement side and the advantage side. So you're getting somebody that's seasoned, knows what they're talking about, knows the industry, knows the insurance carriers, can answer all of your questions, will always be there for you. The last thing I say to a client is, no matter what the situation is, finding a doctor, having a question, you can always call me. And that's one good thing. If you want to come into the office and sit down and talk, you have that option also.
Well, I certainly have that feeling about you because, just meeting you in person for the first time and actually haven't spoken to you on the phone, I already felt a very nurturing Leon.
Well, thank you.
Somebody who's not rushing, somebody who would like to take the time to explain because, when you're overwhelmed and also you're on information overload, you get to be on analysis paralysis and you don't do a damn thing.
Right.
I'm not supposed to say that on TV, but
Well, Medicare is complex. Right? Our job, right, is to make it simple. Right? Treat the client with respect. Never rush them. Right? And always try to do the right thing. Right? If it's right for the client, it's always going to be right for our agents at Golden Years Design Benefits.
those people, like I see a lot of ads on TV. So I don't know, is there a bait and switch, or is like, I want to understand, like, those people make it sound like, the whole process is like so easy.
Yep.
And so what would you advise people against, dealing with people like that?
I think what most people want, all right, and we've been doing this for over 30 years, is they want a relationship.
Right.
Right? They want to be able to call you. If I'm not available or if I'm on vacation, there's 5 other people in my office that work on our client services team. I can't find my ID card. How much is that copay? And so if I'm not available to answer the phone, then they call the main number, and there's multiple people to help them on an annual basis. Each year things change with Medicare, right? So if you call 1-800 or you call the telephone commercials, they're basically selling your information to somebody else.
Right.
And so you don't really know who you're working with.
Oh, so they're like third party.
It's a marketing firm, right? They're either sending you to a massive call center. The likelihood that that agent that worked with you is going to be there in 2 years is relatively low, right? Because they're not an owner of a business.
Right.
So we strive to have relationships with our clients.
I like that.
Right? And every year we have the opportunity to do reviews, right? And figure out if they're still in the right plan. We have people that have been with us for 10 or 15 years, changed their plan 4 or 5 times to lower their premium, and we're happy to do it. Some people switch. Right, from a Medigap to a Medicare Advantage plan.
So
Absolutely.
what factors affect them switching from one product to another?
So you mentioned it earlier. A lot of times people that have a Medigap plan or a supplement plan, they get the cost. They're like, listen, I can't afford this anymore. What about these plans that I'm seeing on TV that's saying 0 premium? Is it true? Is it true? And I go, yeah, it's true. Let me explain how it works, why it works, and how it might be able to help you. We don't push anybody into one plan or the other. Make sure it works for you. These are your options. These are the pros. These are the cons. Think about it, and then make a informed decision.
I think the people on the phone are just looking to make a sale.
Right.
Right? So my reputation, right, as the owner of Golden Years Design Benefits is more important than one phone call coming in, switching somebody from product A to product B.
Right.
To me, it's not worth it.
No.
Right? I would want to make sure that we're putting them in the right situation, the right plan. Now, if you call the TV ads, they're going to tell you that, Medicare Advantage is just like Medicare supplement insurance. And the two are different programs, right? And we shouldn't overpromise on either one. We should say, here are the pros and the cons. If you go from A to B, this is what it looks like. And so we treat everybody like their family, right? We always want to put them in the right situation. And if they're in the right plan, we're going to say, you're probably in the right plan, and we're going to say, stay in your right plan, and give us a call next year.
How much percentage on your client base right now go on kind of like autopilot, auto renewal year after year? And how many would you say actually need to be
reshopped, right? Yeah. So I would probably say we probably get 30% of our client base that's calling in during the Medicare annual enrollment for a plan change. I mean, if we just enrolled somebody last year and the plan hasn't changed, their situation hasn't changed, or on the same medications, they see the same doctor, then that situation is, let's just let it automatically renew. There's nothing that you need to do. If somebody moves down to Delaware or moves to Arizona, like we're licensed in all 50 states. So depending on where you move, where you live, we could help you.
So why would the location change? It's United States.
So insurance is basically sold in a service area. So we're in Ocean County. There are certain plans here in Ocean County that may not be available in Monmouth County. So if you move from Ocean County and you move down to Rehoboth Beach down in Delaware, right? The plans that are here for Medicare Advantage and Part D prescription drug program may not be available in another area. So after you move, there's a limited window to make a plan change, and you would be required to do that.
When you say service area, what exactly does that mean?
So a service area would be Ocean County, right? So there are certain plans that are designed for Ocean County. There are certain plans that are designed for Monmouth County or Middlesex or Burlington, right? So Medicare Advantage plans are deemed by a service area, and the benefits could be different from one county to another, depending on the insurance company.
You also said during one of our conversations, Medicaid you also process through your company. Is that correct?
So a person gets Medicaid based on what? Their income.
Okay.
Right? So if we talk to somebody and they say, well, I only make a certain amount of money, and we say, well, I think you may qualify for extra help, which helps with your prescriptions, or Medicaid, so we can kind of point them in the right direction to see if they'll qualify for Medicaid. Why? Because Medicaid will pick up that $164.90 for you if you qualify for Medicaid. So there's advantages to that by doing that.
I'm just curious, like, would say, for example, those salespeople on the internet, would they steer away from the Medicaid because they would not make commission?
Not necessarily, because they may not go the full realm like we all go to wait for you to get the Medicaid. Give me a call back when you get a notice from Medicaid so we can see what kind of plan we can put you in. Steps.
Yeah, I think the issue is the people that are buying those leads in the internet. They may not be from New Jersey, right, and so they may not have local market knowledge of the different Medicaid dual special needs plans that are available. One of the things that I'm very proud of our agency is that we can help the highest net worth client, an attorney, a doctor, entrepreneur who's making multiple millions of dollars, and I can make them comfortable in what their choices are. On the other end of the spectrum, we can help people that are just living on Social Security, right, that have a $600 benefit, and we could pick and design the right plan based on their situation and treat everybody with respect in between, no matter where they fall in terms of their income and assets.
Wow, that is powerful. For you to be able to service people very equally, regardless of their income, is really, really relevant, important, and quite powerful. That's an unbelievable factor that you have just mentioned, because people are intimidated.
Yes.
People are scared, and that they don't have the ability to afford all of these benefits available to us. For those people who may be undocumented, is there a program that is supported by the government for them to get some kind of benefit coverage?
So there are rules that the government has on what your eligibility is for Medicare A and B, right? You have to have original Medicare to pick a secondary plan. So if they're not sure whether they're eligible, we would recommend that they go down to the local social services office here in Ocean County, schedule an appointment with a case manager, and go through the process to see if they're eligible for Medicare benefits.
Oh, thank you for that clarification. Something that I actually love about Golden Years Design Benefits is that your mother actually was the one who built the business.
Yeah, Mom started the business.
Yes, so talk to us a little bit more about the background and how your mom was so passionate about, servicing this demographic.
Yeah, so Mom became insurance licensed after my father passed away when I was 15, and she needed to figure out a way to help her two children. And she got insurance licensed, and each year got smarter and smarter and smarter, and she became more successful. She eventually added staff, and in 2016 I left my job in the pharmaceutical industry to work with my mom. And we always try to do the right thing by anybody, whether you're brand new to us or if you're a client that's been with us for 10 years. Our goal is to treat you like family and make sure that we're there for you and we're there to help you.
Oh, that's beautiful. And what's your background, Leon?
So my background, I was in the mortgage business for 15 years with Washington Mutual, and in 2008 everything imploded. I said, wow, what can I do? I got a call from someone that told me about this industry. Leon, you're really good with people. I think this could work for you. I'm like, well, I don't know anything about Medicare. I don't know A from B. I don't know what D is. What is this stuff? What's the C? I had no idea, all right? So I got my license. I got recruited by United Healthcare, where I started out. And I realized that this was helping people, just like first-time home buyer. I like this business. This is pretty good. So I realized that I could be good at it just by being myself, helping people, answering the questions, not making people feel ignorant when they talk to you, because that's a problem too. People call and they're like, oh, this guy's going to make me feel so like I don't know anything. Right. And we try very hard to listen. Just listen to what I'm saying. I'll explain everything to you. And I started to build on that. And I realized that I'm really helping these people. And then you start getting referrals. You got to call my guy Devin. You got to call my guy Leon. He's got to help me. And we go out into the community. We do this same thing. It's really
you were saying that you do seminars, and so because in that seminar they will be able to you'll be able to address a lot of the questions that's bugging.
Yeah, there's like 6 or 7 questions that usually come up. So we've heard literally all the questions, all the situations. So we love to go out in the community, educate people about what their options are. We typically do a seminar for 60 to 90 minutes, and then we get to know each other, right? They say, do I see myself working with the Golden Years team, right? Based on how I answer questions, how I react with people. So there's no better way to bring on new clients into the agency than going out in the community and really helping people.
Right.
Actually, how I found Leon is because I was at the John Bon Jovi Soul Kitchen, and I saw an ad there that you said about Medicare, and I said, oh my goodness, I said, I got to reach out to this guy because I have a lot of people in the community looking to looking to reach out to somebody who is an expert in Medicare. And before we wrap up, I just want to be able to get the chance to actually share with the audience how amazing my experience was visiting your office, because they have a gorgeous office in Freehold, and the welcoming, the whole ambience, the energy in your office, the warmth, was just superlative in every way, and I could not be more thrilled. And I know it's very professional. You're extremely knowledgeable. Z actually was also phenomenal, like a manager there. Also in building your team is really a glue in helping build your team as well.
Well,
right?
We know Medicare is confusing, right? And what we learned from helping over 7,000 people is that you have to build trust, and trust is earned. So it starts when people come into your office and want to feel welcomed, right? Our staff is very well trained to make people feel comfortable. Everything about our office is to bring your emotions down, because a lot of people have anxiety about Medicare.
Absolutely.
We know that. We want to make sure that you're comfortable when you walk in and you have a great experience working with one of our licensed agents.
Okay, people are waiting for you to share. First of all, what's your phone number? How do they make an appointment with you? Where are you located? Please share all of those.
So we're located in Freehold, New Jersey. You can call our office for a free consultation. We can be reached at 732-526-7659, and you can check us out on the web at www.yourmedicaremarketplace.net, and you can check us out there.
Yeah. Golden Years Design Benefits. Last words. What would you say for somebody who's already ready to reach out to you? Give us like a couple of tips that you feel is going to make them move now so that they don't miss out on anything.
I think it's really about reaching out to an expert that could put them at ease. Our motto is one call and we take care of it all.
Ooh, one call and they take care of it all.
That's it, right? Because Medicare is confusing. There's lots of different scenarios. Call us. We will walk you through what you should do at no fee, and we're going to treat you with respect. What else can you ask for?
And the good thing is, you'll call the office, you can ask for Devin, you can call the office, you can ask for Leon, we're there to help you. You'll be talking to us directly.
Oh, definitely. I can feel your heart. I can feel the passion and your commitment to excellence when it comes to servicing clients in the Medicare. What other services do you offer there besides Medicare? What other products? Just give me a quick.
So we help people with long-term care insurance. As we know, there's limitations to what Medicare covers. And so if our clients are interested, right, we can help them with long-term care insurance. And then people that are also willing, and then we can also work with people that want to take some risk away from their portfolio. We do help people with certain financial products to help de-risk their portfolio.
Also life insurance, do cancer insurance, different types of policies like that too. Final expense, term insurance, whole life. We can help people with that also. Because what happens, people leave their job and they lose everything.
Yeah.
They lose their medical coverage, they lose their life insurance, they lose their dental coverage, and they're lost.
And we also help our clients with their children too.
Right.
So if they have a 40 or a 50-year-old child, we could also help them with certain products that might make sense for them.
Oh, one-stop shopping. Isn't that amazing? That's why one call, they take care of it all. So like as I've said, it's very comprehensive what you do. And most of all, what's really really immensely profound for me is I can feel your heart in the service that you provide. So thank you so very much for sharing a lot of light, and I'm sure there'll be a lot more questions, and I invite every single one of you out there to make an appointment with Devin and Leon or whoever is in their office, because they're all qualified there and very knowledgeable. Make sure you don't miss out on that enrollment period, because you don't want to forever be tacked in with a late fee. And at the same time, be able to explore the different ways that you can protect yourselves, your family, and continue to live your life very vibrantly and also with a lot of peace of mind. On that note, this is your host, Ferlie Almonte. Make sure that you take care of your medical and Medicare needs, is what I wanted to say, because that is something that's really going to empower you to move forward in life with a lot more resilience when you're 65 and up. Take care now. Until next time. Bye-bye.